So if you're noticing that someone maybe, they were doing something before and they're now not doing it, or finding some other reason or some other person, to kind of jump in and do things. If you're noticing that maybe the person kind of snaps a little bit too easily, or is fighting you back, or is becoming too angered too quickly, those could be indicators of anxiety, because those are sort of symptoms of the way in which the body naturally reacts to when we're experiencing fear. So that's fight, so that's the anger and the pushing back. Flight, which is trying to get away from that situation. One other way is through freezing, and another way is through fawning. So freezing is kind of freezing up. Literally, fawning is kind of cowering back. So those are different ways in which we might see our coworkers interacting in the workplace with different things.
Welcome to another episode of The Irreplaceable Dental Assistant. Now, you have heard this guest before, and I am delighted that he kept his promise to come back and share with us again. But today we're going to flip the switch. Last time we were speaking about our clients and anxiety there. Today we're going to be talking about our colleagues or teammates. Welcome, Dr. Jarell Myers. So good to have you back.
Thank you for having me back. Very excited to be here and continue the conversation.
Yes. There were so many pearls that you dropped on us the last time that it took us about a year to soak it in before we could return to get some more pearls from you. So, for those folks who may not have caught you the first time around, can you share a little bit about who you are, what you do, how you show up in the world?
Sure. So I am a clinical psychologist based in New York City. I work at a private group mental health practice called the Center for Motivation and Change, where we address people who struggle with comorbidities, what we call comorbidities. So that would be basically having one thing and another thing. Our specialty is in helping people who may have a hard time with substance use disorders. My specialty is in working with people who also experience mood disorders. So that would be anxiety, depression, and some trauma work as well. I have a private practice on the side, and then I have some other exciting hobbies that I like to engage in just to spice up life.
Sounds good to me, right? We have so many talents within us. It's good that we may serve in one way, but there are many other ways that we find fulfillment. That's
absolutely
good.
Absolutely.
I love that. So I have so much to talk to you about. I'm just going to delve in and ask you, Dr. Myers, what are common signs and symptoms that may indicate to our team members that somebody's suffering from depression? And then afterwards, share with us some signs and symptoms why that would indicate to us that folks are suffering from anxiety.
So that's a great question. As someone who's trained to look out for those things, I'm looking for specific changes in the way that someone may be interacting with the world, with the way that they may be functioning. Those specific things don't necessarily always spell out in a very black and white way that someone is experiencing depression or anxiety. But I think that the thing that we're able to pick up on pretty easily as humans is when something has changed or something doesn't feel quite right with the individual. So as a team member, you have the opportunity to interact and work with people on a regular basis. You get to know their general habits, how they interact with others in the workplace, the type of things that they typically do. And so if we begin to notice that there's something different based on how someone may be acting or the way that they may be reacting to something. Or it could just be in everyday regular behavior. So someone who's regularly on time now showing up late to work, or someone who has a much shorter fuse. Those type of things tend to indicate that there's something off. There's something different that's happening here that may need some paying attention to. Now, it's really hard because it's not as if we get a full background on all of our coworkers and we have a full sense of everything that's going on in their lives. Someone in my position gets more of that information. But our instincts on picking up on when something is a bit different with our coworkers, that is the key, I think, to indicating that something may be going on. You may not be able to pinpoint it, but I think it does indicate that something may be happening. For someone who is experiencing depression, there are certain things that we look out for in the field. One is that you've noticed that their mood seems a bit lower. So maybe lower energy, or they just seem down, or whatever the case may be. But it seems as if things are a bit lower for them, that they're not able to maintain or keep up the kind of same interaction that they've had in the past. And that's happening for most days. So, it'd be one thing if I'm just having a bad day and my mood is a little bit lower, or I've had something happen in my personal life and I brought it into the workplace a little bit in the sense that my mood is lower. But if you're noticing that happening day over day, that may indicate that something is going on. It may indicate that depression or a depressive episode, may be present. We look out for sort of more physical things. So if you're noticing like any weight changes, significant weight changes that have not been that they haven't been talking about or haven't been working on. If you're noticing that they're more tired, or it feels as if it looks as if they're not getting that much sleep, if they appear to be more irritated, or it just seems as if they're not engaged whatsoever. If you're noticing that they're making more mistakes or they're having issues with concentration, all of those things may tend to indicate that depression may be present. Now, when we're looking at our colleagues, there are going to be moments when all of these things happen. So it's not as if that we're looking at each individual thing and saying, oh, because you had a hard time concentrating, it means that you're probably depressed. It could mean a bunch of different things, but what we're looking for is the combination of those things kind of coming together. I think, in my mind, I'm thinking about specific things for the average person. They may not need, they're not going to need to think about those things. I would stick to, if you're noticing any issues coming up with your coworker, anything that seems off, trusting your gut that something may be present, that would be a good indicator that, hey, I probably need to pay attention to this. In the same vein with anxiety. So anxiety is fear occurring over and over and over again about some specific topic or some general topic. Anxiety can span the gamut around whatever, whenever, however. So if you're noticing that someone maybe, they were doing something before and they're now not doing it, or finding some other reason or some other person, to kind of jump in and do things. If you're noticing that maybe the person kind of snaps a little bit too easily, or is fighting you back, or is becoming too angered too quickly, those could be indicators of anxiety, because those are sort of symptoms of the way in which the body naturally reacts to when we're experiencing fear. So that's fight. So that's the anger and the pushing back. Flight, which is trying to get away from that situation. One other way is through freezing, and another way is through fawning. So freezing is kind of freezing up. Literally, fawning is kind of cowering back. So those are different ways in which we might see our coworkers interacting in the workplace with different things. It may be really difficult for you to figure out that is what's happening, because you're focused on your own life. You're focused on everything you have to do in the workplace. You're focused on, how to advance yourself, all of those things, right? So those things are still present. So I will stick to, if you are noticing that there's something off, that you've noticed a certain pattern and now that pattern has changed for the coworker, it probably indicates that there's something going on.
You've said a lot, but I think a lot of what you said, we can definitely relate to with ourselves at some period of time, but also things that we may have noticed. And when I think specifically of my situations, when I've noticed people snappy and combative, I've automatically thought, disrespectful. But maybe I need to pause and see, is there a lot going on in that person's life? Are they struggling with some things? So rather than responding by getting offended, maybe I need to get curious.
Yeah. And that's a hard thing to do, honestly, because we're not necessarily trained to do that. We're trained, quote unquote, trained to whatever the first kind of assumption is, to stick with that, because that's sort of how our brains have put together the puzzle. So this person is acting this way, it must mean this about them, as opposed to, let me look at all the different solutions or all the different causes for what could be attributing to that and make it a decision on what that may be.
Okay, so Doc, how can team members create a supportive and non-judgmental environment for someone with depression in the workplace?
Yeah, so it's tough because in most places, I think we're getting better as a society, as a whole, global society now. But in many places, it still is hard to talk about what you are experiencing or what you're going through. We have, for the most part, grown up in a world where we are told to push through or not pay attention to those things and act as if, let's say, breaking an arm is completely different from having a depressive episode. In addition to that, mental health things are not necessarily seen on the surface. We're always able to come up with different reasons for the person behaving in the way in which they behave. And because there's so little known about mental health, there's also a healthy fear of it. I don't know what to expect. I don't know what's going to happen. And so I'd much rather avoid that. I push that away. So, pull yourself up by your bootstraps. You're not supposed to feel that way. Just keep pushing through. All of those things, I think people are attempting to be helpful. But what it says to that person is what my experience isn't valid. That it's not bad enough for people to pay attention to, that I'm just supposed to figure it out and then move forward, which I don't think is a helpful way of going about addressing mental health. I think first, go ahead.
Would you say, in other words, then the assumption is made, this person is just weak and they just need to tough it out like the rest of us?
Yeah, I think sometimes that can be the assumption that's made. I do think, though, that nowadays there are more folks who are paying attention to mental health and may not necessarily be fully aware of everything that's involved with it, or how to treat or what to say or any of those things. But I think awareness begins to breed solutions. So the fact that we are much more aware of the fact that it is present and it can be debilitating in many different ways, I think that offers the opportunity for us to explore different kinds of solutions. I think in the workplace, first and foremost, there has to be education about mental health and mental health services. We have to make that as common as talking about first aid, right, in a dental office, or about sterilization. It needs to be the type of discussion that we have so that people are aware of the fact that you are not an outlier because you're experiencing something, and you don't just have to suffer through in order to make it to the other side, but that there are ways in which you can get help. By supporting education for the entire workforce, I think what you're then allowing to happen is openness to conversations about what people can be experiencing. Now, I'm not necessarily talking about turning the dental office into a psychologist's office and having everybody at all points in time talk about what they're experiencing, but we should have an open enough environment where if I am struggling, I can at least say to you, hey doc, you know what, today is not a good day for me. It's been a rough week. Things have been really bad. And not necessarily that I'm expecting you to do anything about it or to fix it for me, because I think that's what a lot of people think. Me talking about what I'm experiencing is not me asking you to fix it. It's more so me unburdening myself so I'm not carrying it on my own. So I think creating an environment in which I can sneak 5 minutes with a coworker and just say, I'm struggling, or talk to my boss and say, you know what, this has been really, really hard for me. Are there resources out there that I can access? But having that be a part of the culture within the workplace, I think starts to change the way in which we interact with mental health and mental health awareness.
Wow, you have just dropped so many gems. You know, I'm thinking of the fact that we are so busy treating patients sometimes that we don't stop to think about the person to the left or to the right, except that they're not doing that fast enough so that we can do what we need to do to serve our clients. And also because there's a stigma attached to mental health, maybe not as much as before, but still to some degree, people may not be as forthcoming. So what practical steps can team members take to create a positive and inclusive work environment for individuals with, say, anxiety?
For individuals with anxiety, I think that they are very accustomed to interacting with the world in a way in which they find ways to take a step back. So if you think about what fear is, and as humans, how we have learned to interact with the emotion fear, it's that I get out of that situation. Fear is an emotion around survival for humans. The goal of it was to keep us out of dangerous situations, or to be wary of dangerous situations, and help to motivate us to stay alive, or to do whatever we need to do to stay alive. If I've learned over time that if I experience fear or anxiety, I get out of that situation as quickly as possible, when I'm experiencing it in my everyday life, it makes it very difficult for me to continually get out of those kinds of situations. It means I'm being forced to face the type of things that I don't want to have to face. And so I become much more adaptive. I learn different ways to kind of get around it, or do different things to get out of that kind of situation. If we're seeing that there's someone who is in our workplace who is avoiding things or trying to get out of things, and all those types of behaviors, I don't know that we can necessarily help to change things for them. But what I do think is that if we're allowing an open conversation to occur about whatever it is that a person is experiencing, it gives us more opportunity, one, to understand what's going on for that person, and two, begin to think about what help can look like for them. So let's say that someone has had a hard time with sharp objects. Dental offices are filled with sharp objects. And so let's say I've had a hard time with sharp objects. I'm worried about handling sharp objects because I'm worried I might hurt a patient or hurt a coworker or even hurt myself. You might find that I'm getting you to grab everything for me and set up in the next room so that I don't have to do it. Or I might try to, work my way closer to the front desk, so all I have to deal with are pens and pencils and computers, as opposed to continuing to be an assistant working in the back, right, with the patients in that regard. If I am aware of the fact, if I've made my coworkers aware of the fact that this is hard for me, this is really tough for me, I think a lot of times what we tend to do with fear is help that person continue to engage in that fear. So because of how accustomed we are to how uncomfortable fear is, we try to help get that person out of that situation. So you'll want to try to help me by, all right, don't worry, I'll set up for you, but you just stay by doc and make sure everything is okay, take care of all things. But the way in which we actually help with anxiety is by showing someone that their worst fears are tolerable. So if someone is having that kind of difficulty and they're open to having their coworkers work along with them to get over those types of fears, then coworkers can help support them by encouraging them to do the thing that they're finding difficult to do, right? Or not helping out in the way that they have been helping out, not at the expense of the patient, but just to make sure that this person has more of an opportunity to engage with the thing that's been difficult for them. So I think inside any office, dental office or any office whatsoever, it can be hard to really address these things. I think more so what it is that we have to be willing to have these types of conversations and see what the person is willing to do in order to receive help from their coworkers, whether it is just about being able to unburden myself or going as far to you're helping me out in different ways to help me get through this really difficult period.
Okay, so I have a question that has just come to mind as you were speaking. As an employer, I don't know if there's any kind of screening tool that's available for me to be able to determine not personality, not strengths, but maybe wellness, emotional wellness of a person, because you said it, if someone really will not be able to perform well in the clinical area, even though they've been trained and on paper they look perfect, but the rhythm in the clinical area, as you say, they may have challenges with some of the instrumentation, they might be better suited in the front desk. And if I knew that in advance, it would help me to position the person in a way that it would be less anxiety for them, it would be less burdensome on the team, and it would be an overall better fit for everybody. So is that discrimination? Is that being more aware so you can position people properly? What are your thoughts on that? And I know I'm just taking you by surprise, because I really just thought about this.
Yeah, so I think in an ideal world, coming from a place of pure desire to help someone, having an instrument there that helps evaluate where they are or their own overall wellness can be helpful in making a decision on where you might want to place someone for the most success that you can have. I think, unfortunately, we live in a world that is very discriminatory in different ways, right? Whether we have conscious or unconscious biases. And so as a result of that, we could take that in. I could see anyone taking that information and using it against a future employee, as opposed to looking to truly help them. Again, unfortunately, because as much as we have evolved as a global society to look at and address mental health and mental health issues that may be coming up and wellness overall, I think we're still somewhat in the dark ages around the layperson's talk about it. We don't quite really understand what depression is. We don't quite really understand what anxiety is. We don't quite really understand what trauma is. We have these ideas about what it might be, but it's not necessarily a true indication of what it actually is. Mm. And so, unfortunately, if the average person who is unaware or doesn't have enough education, not that they haven't been educated enough, but again, mental health is one of those things that we're just learning about as a global society, right? That is just becoming regular in everyday parlance nowadays. So we're not that educated as a whole on mental health, and unfortunately, I think it might be much more likely to be used against someone than it would be used to help them in the office.
So because of the possibility of discrimination, then screening to determine if somebody mentally can manage a position may not be readily accepted?
I don't think so. I think the much more effective way of doing it, and this is going to come at cost to dental offices, unfortunately, but I think it's going to be about trying them out, right? So you may have been trained to be an assistant, and practically you've got it down. You know all the ins and outs. You know exactly what to do, and yet still, when you walk into a dental office, they're not going to, well, I don't know all the different terms, but they're not going to make you do a root canal day one, right? You're not necessarily going to be assisting the dentist in doing a root canal day one or a bridge day one. Your job may be assisting or just kind of walking around and learning where everything is, or helping the hygienist as they are doing a cleaning, or talking someone through, or being with the dentist as they're talking someone through doing x-rays or learning how to do x-rays. So you're not even being thrown into the deep end day one. So it may just be about being tried out in different areas and seeing what fits or what feels most comfortable for you. I think that can be a way that, we support where people are. For the most part. And I think having that as a foundation. So if I know that you're going to do much better at the front desk as opposed to helping out in the clinical area, then if something goes off the rails at the front desk, I know I have the foundation that that's where you're doing your best work, and now things aren't going that well. It's an indication to me that perhaps there's something that we need to look into here. And it's not just about your desire to work or you becoming quote unquote lazy or disrespectful, but that there could be something else to the story that's contributing to why you're acting the way that you're acting.
So I think, Dr. Myers, we've come full circle to what you began telling us initially, heightening our awareness, being aware that people may be struggling. It may not be that they're lazy or disengaged, but understanding the nuances that begin to become apparent when somebody is struggling with anxiety and depression is key. So what are some warning signs that indicate a team member may be struggling to cope with the stress in the workplace and may need additional support? Because there are times when it's just a stressful season, and there are times when it's more than that. It's anxiety, it's depression. What are some signs that as team members we can begin to say, Pop? You did say, you named some things in terms of anxiety early on. Perhaps those are the words that we need to focus on. I think one was hiding away, one was avoidance, but you use particular terms for them. Could you?
Yeah, absolutely.
First of all, would that be relevant? And if so, could you remind us of what they are?
Yeah, so I think that in general, if you are noticing something different and it's happening over a period of time, so it's not just one day or a couple days, but it's a week or a couple weeks or a month, that is an indication that there's been a real change there and that there may be something underlying that change. If you've noticed that someone has been doing something on the regular for a period of time and all of a sudden they're not doing that thing for some reason, it's an indication that something has gone awry or there's an underlying reason why that person is behaving the way that they're behaving. The way that I think about it is I only have a piece of the story. And I know that I have a bias to make an assumption about what the other pieces may be, that I have a bias to try and simplify the reasons behind why someone is doing what they're doing. And if I can be aware of the fact that that is there and at the same time still understand there's a lot more to the story that's there that I don't have access to. And so because of that, there may be more that I need to get more information around, that can be a helpful way of approaching something that you don't quite understand, right? When it comes to anxiety, as humans, we react in certain ways. So we try to get away from that. We avoid, we do what's called flight. We avoid that thing. We fight back, and that typically looks like pushing back, anger, that type of thing. We may freeze up in that situation, and we may fawn or cower away, right? So the 4 F's: fight, flight, freeze, fawn, right? We might engage in any of those behaviors when we're experiencing fear or anxiety, because that's the way in which we've learned to interact with the world. That if I'm able to, if there's something that triggers that fear for me, I can get away from it and I feel much better afterwards. For someone who may be experiencing depression, it may not necessarily look like what we assume depression looks like. We assume that someone is just sad all the time, and it may not necessarily look like that. There are people who you may see smiling all the time who have been diagnosed with depression. I think, again, it comes down to what are you noticing that is different? Is that person's mood looking a little bit different? So that might be the sadness part. But are there physical things that are different? Are they more irritable? Have they lost a ton of weight? Or have they gained a lot of weight? Does it seem as if they're really, really tired because they're not sleeping at night? Are you noticing that in the way that they're verbalizing things, it seems off? It feels very different from how they're accustomed to verbalizing things. Those are indicators, again, that there may be something going on. Now, look, we are taking this as a whole. We're not looking at each individual piece. And just because I may think that something is going on may not actually mean that anything is happening, right? But the more in tune we are with our team, the more in tune we are with how folks may be acting and reacting to things, the more likely we are to notice when something feels a little bit different. And that invites us to be more curious about it. If the individual is open to being curious, to having us ask more questions. And if not, then at some level, we can give them the grace or pay them the benefit of the doubt that this behavior is an outlier. It's very different from how they typically act. And so it may indicate that there's something going on that I don't know about, but perhaps I can be empathetic towards them around.
Wow. There is so much to digest in what you've said to us today. I think we're going to have a part 3 at some point in time, Dr. Myers. I think you're hooked for life. Because one conversation can lead to so many other tributaries, right? Because it's not as clear cut as we would imagine. We spoke a lot about the team and understanding depression versus anxiety, understanding that it's not clear cut, understanding that we really should be curious rather than making assumptions about how someone is behaving. And most of all, we should recognize and give room in dental offices for there to be some degree of discussion, education, and support as it relates to mental health of the team members. Thank you so much for that. There is this person, Etty Hilsum, and her quote is, "Sometimes the most important thing in a whole day is the rest between 2 deep breaths." And I think you would encourage us as much as possible to exhale.
Yeah.
Looking
absolutely.
at that beautiful picture behind you, it looks so calming and scenic. So just a quick question. When you feel overwhelmed and stressed, do you take yourself to that place in that picture?
Yeah, that's one of the skills that I use to help myself when I'm feeling stressed or overwhelmed, for sure.
Well, I'll let you in on a little secret. I worked 6 days this week and I was invited to an event and I thought, oh my goodness, after 6 days, I just want to go home and chillax. But it was a fundraiser for my JDA organization. It was a sip and wine. I didn't have any wine, but I certainly did decompress, and this is the end result.
Wow.
It doesn't look fantastic. It's not
it looks great. It looks
professional
great.
as what you've done there. But even in your quiet time, you can find ways to do things that will bring you a little joy, right?
Absolutely.
To bring down the stress. Dr. Myers, Wonderful to have you on again. Please, please, please. You did it before and you showed up. Please promise us that you will come back another time and share some fantastic gems with us.
Sure, I'd be happy to.
Well, here we go again. Another information-packed session. Wow, so much to take in, but so relevant. I'm sure, like me, some of you were thinking of some situations, some people, and reassessing, wondering if that person was, or wondering if I was, right? Well, here's the thing. The more informed we are, the more we are able to manage what's happening in our environment, the more we're able to manage what's happening with ourselves, and the better we'll be able to serve our clients. Remember now, if you see behavioral changes, it's a red flag. But we can't assume that we know the whole story. We just know a piece. And we must realize that there's a lot more to the story. Let's not minimize, let's not assume that we understand what's going on, but let's be curious. And also remember the 4 F's that he gave us to begin to tune in to determine if this client or this teammate may be suffering from anxiety. The first one was flight. Are they avoiding? The second one was fight. Are you getting pushback or anger? The third one is freeze. Are they just not able to move? And the last one is fawn. Do they cower and hide? Let's take a deep dive and really look to see what is happening with those around us who are working with us on a daily basis. And I'm just going to remind us of this wonderful quote by Eddie. Sometimes the most important thing in our whole day is the rest taken between 2 deep breaths. Yes, there is such a thing as a cleansing breath, as a relaxing breath, as a stabilizing breath. And when the world feels like it's too much, sometimes it's just good to stop and exhale. Life is better when we live, learn, and grow together. I'll see you on the next episode, whether it be YouTube, Spotify, Google, Apple, whatever. We'll connect the next time.